My name is Nikhil Bhojwani, and I'm the founder of a healthcare consulting firm called Recon Strategy. And for those of you who don't know our guest today, maybe because you just arrived from Mars or you've been living under a rock for the last few years, our guest today is a co-founder of one of the most exciting companies in Boston, Ginkgo Bioworks, Dr. Reshma Shetty. So Ginkgo was in the news recently because they just debuted on the New York Stock Exchange for a valuation of about $15 billion. So, but you know, our guest is she's far more interesting than that number, and we're looking forward to having a really good conversation to hear about the story. She founded Ginkgo Bioworks along with 3 other graduate students at MIT and their graduate advisor in 2008. They then took 6 years, a pretty slow start, before they first raised any money. Then they took 6 years, accelerated 6 years to get to the New York Stock Exchange. And in the next 6 years, they're going to, I don't know, take over the world or something. Now, Reshma herself is Chief Operating Officer and really right in the midst of scaling this business. Forbes calls her one of 8 people inventing the future. Fast Company named her one of the most creative people in the world. Business Insider called her one of the most powerful female engineers. She's won the Rosalind Franklin Award. And I can just keep going. I can use up the next 25 minutes with that, but I don't think that's what you came here to hear. Please give a warm welcome to Dr. Reshma Shetty. So, Reshma, welcome. This audience consists of, many of us are entrepreneurs here. And of course, we know what it takes to start a great company, right? You have a great idea, you license the technology, you raise some money, you've got a product, you get some customers, right? I think I missed.
Well, I think for us, the first thing we did at Ginkgo, when we started the company, actually, before we even had a name, is that we actually came up with our mission statement. So our mission at Ginkgo is to make biology easier to engineer. So, you know, those of you who are entrepreneurs, you know how hard it is to start and run a business. And so, you know, for any early stage founder, I really encourage them to think about, like, why are you doing this? What do you want to change about the world? What's your mission for your organization? And so to me, I think that's actually the most important and first thing that folks should do if they're an aspiring founder.
So you started the company without money, you started the company without a product, but you had a mission.
That's correct.
You want to tell us a little bit more about that mission?
Yeah, so I did my PhD at MIT, and when I first showed up on campus, I met this person, Tom Knight, who ultimately became my PhD advisor. And Tom was trained as an electrical engineer and computer scientist, and about now probably 30 years ago, he decided computing was getting a little boring, you know, that all the hard problems had been solved, of course, and that the interesting thing to program in the next century was going to be biology. And, you know, I was 22, totally naive, had no idea what this entailed, but it sounded pretty compelling. And over my time at MIT, I fell in love with this new area called synthetic biology, this idea that you could program life, right? That DNA is digital code, just you have zeros and ones in computers, and you have A's, T's, G's, and C's in cells. And so falling in love with that space is what sort of set me on the path to ultimately starting Ginkgo.
That's great. And you guys bootstrapped for a while. We've all heard the saying that one man's trash is another man's treasure. In this case, one company's trash can was another company's treasure. Tell us how you built $1 million lab for a tenth of the cost.
Yeah, so we had really good timing when we started the company. We decided to start in 2008, which many of you might remember was kind of the height of the fiscal crisis. So, if you plot a chart of NASDAQ, it was like Ginkgo starts, NASDAQ crashes. And so between the fiscal crisis and the fact that we were, a bunch of grad students who had no business experience whatsoever, and we had no product and no money, etc. No one really wanted to fund us, I would say. And so we were sort of faced with the challenge of how do we start this company with sort of zero outside capital. But because it was the fiscal crisis, it turns out that a lot of biotechs were actually going out of business. And so we had a little bit of seed money from Tom, and so we went around with a U-Haul and would pick up lab equipment that other companies were essentially fire sailing because they were about to go under. And so we built our first lab for about $150,000, which for anybody in the biotech industry, you'll know that's pretty cheap, right? Probably at least an order of magnitude cheaper than most labs get built out for. But by being creative and doing some dumpster diving, we were able to sort of, and having some patience. Like our first lab didn't open until about a year later. That's how we sort of got ourselves off the ground.
Okay, that's great. So let's now walk this audience through the journey and tell us about some of the learnings along the way. So one of the things that really struck me when I looked into this company is that we work with a number of startups, and a lot of the conversation among early founders is the roles of various people. Even today, as a public company, Ginkgo Bioworks lists the founders just as founders. Tell us a little bit about the dynamic of how you all came together as a founding team and how that's evolved.
Yeah, so we all met in grad school, and a couple of us were in Tom's lab, and a couple were in Drew Endy, another professor's lab at MIT. But on paper, we were identical to each other, right? You could basically swap our resumes, and no one would know the difference. And so when we started Ginkgo, I would say, we were very haphazard in how we assigned roles. So it was like, Austin had taken an accounting class at Stanford. Okay, you're in charge of finance. Barry really wanted to do technical stuff. Okay, Jason discovered a latent talent for sales, so he became the commercial person. So it was pretty organic and haphazard at first, but the way I think of it is essentially over time we sort of speciated into our own niches, to use some biological parlance. We all had kind of a common core skill set, but over time we just learned and sort of ultimately ended up in very different roles within the company.
Okay, so what were those first few years like before you went to Y Combinator?
So, when we started, we had a mission. We had a vision for what we wanted to do, right? We wanted to, leverage biology to solve some of the world's most pressing problems. We had ideas about what technology platform it would take to get there. But we had no business model, we had no products, we had no idea how we were going to make money. And so we were actually big believers in the whole lean startup method, which at the time had been used and pretty widely adopted in tech, but not in biotech. But if you're familiar with the lean startup method, it's essentially the scientific method applied to like entrepreneurship and building a business, right? So you have a hypothesis about what you're going to sell. You talk to customers, you collect data, like how much would you buy of this? How much would you pay for it? And you try to figure out if the data backs up your hypothesis about what a viable business model should be. And so we were PhD engineers. We could do hypothesis testing, and so that's what we did. And it took us a while. It took us 6 years to kind of figure out what a viable business might look like in synthetic biology. But along the way, we could build up the technology platform, and so that was how we finally arrived at our ultimate business model of making and selling engineered organisms.
Got it. And so that's when you went to raise money, after you'd done all of this.
Yeah. I mean, so Tom Knight, one of our co-founders, he had started some computing companies previously, and he had been burned by raising outside capital too early before the company really knew what it was going to be. And so he was sort of a cautionary tale, and really encouraged us to like figure out the business before we went and raised outside capital, because once you do, you're on a, you risk being on a little bit of a clock. And he had seen good companies sort of go under as a result of that clock.
Fair enough, but I know there are also lots of investors in this room who would have liked to be part of your company early on. Presumably investors add some value. So when you finally got Y Combinator,
Yeah.
One, tell us about that process, but also, did you learn anything that you wish you had known during those 6 years before you brought them on?
Well, I think, we had kind of our first customer traction going into Y Combinator. And so for us, it was a really like perfect timing, I think, because we joined YC and it was like, okay, let's go focus on really like accelerating our sales cycle and whatnot. So I think in biotech, the technology timelines are longer, right? So a 12-week program isn't really amenable to making like progress in the lab, but we could really make progress on the commercial side. So I think that worked well for us. And yeah, I think the really great thing about YC is that it exposed us to a whole cadre of investors in Silicon Valley and in the technology space that we didn't have access to otherwise, right? The Boston ecosystem is amazing. It's really rich in biotech, but again, we were so weird looking to them, right? Because we weren't therapeutics, right? We weren't pharma at the time. And so a lot of biotech investors weren't particularly interested in us. But tech in Silicon Valley at the time was. And so it really enabled us to raise, capital. And we would talk about how we wanted to build a world-changing technology company, right? That we weren't interested in a quick flip or an exit. And that resonated more, again, at the time with Silicon Valley investors. I think that's changed now in the Boston ecosystem, but at the time, that's sort of the reception we felt.
Okay, so we're going to note that 6 years is not considered a quick flip. But you'd built this company completely bootstrapped until that point, and now you've got these outside investors. How did that hit the culture of the organization, and how did you deal with that?
Yeah, I mean, because we bootstrapped the company, we were incredibly frugal, right, for those first 6 years. And so it was kind of a shock to suddenly see your bank balance like flip up, particularly after our Series B, which was like about a $45 million round. But I think that frugal culture actually really served us well, and in fact, we were pretty intent on maintaining it even after we raised a lot of outside capital, because it kind of gets baked into your DNA, and I'm a big advocate of raising lots of money but spending it very, very frugally, because it just gives you more optionality in the future.
So obviously people are really important to this organization, and you're talking about frugality. So tell us what Brad Pitt has to do with hiring.
So a couple of years ago, or a few years ago now, we were talking about diversity, equity, and inclusion at Ginkgo, right? And I started thinking about it. And, a lot of people talk about DEI and think about it from sort of a social justice or, doing the right thing perspective. But just coincidentally, my husband and I happened to watch this movie Moneyball. Anybody familiar with this, right? Yeah. And so it's about sabermetrics and how, the Oakland A's didn't have very much cash, and they needed to build a winning baseball organization. And so they essentially went and looked for metrics that indicated that a player was really valuable, but that were unorthodox, right? Not the same measures that most people look at when evaluating baseball players. And what I realized is that, sort of by analogy, there was this whole pool of people out there who, because they were a different gender or because they were a different race or from a different ethnic group, were probably being overlooked by normal hiring practices, right? Just whether call it unconscious bias, call it people wanting to hire people who look like them. For whatever reason, like there's going to be this set of demographics of people who are just undervalued by companies generally, right? And so if you're a startup and you're competing for talent and whatnot, you can essentially take advantage of that blind spot on the part of so many, other companies, and look for the talent that is there right in front of you, but that other people overlook, because again, it just doesn't come in the package that people might be expecting. And so, to be clear, I'm not advocating that you should spend less on these people. You should pay them equitably. But I do think it's a competitive advantage if you can attract and retain those folks, because it's talent that the larger ecosystem is overlooking and not valuing as highly, but is incredibly, powerful asset to your company.
What I love about that is we often hear DEI initiatives in companies as being something you got to check the box on, or something that's a cost. But you've really shown how it's a competitive advantage if you have.
Yeah, I strongly believe, and if it's a competitive advantage, then it means it's something that you should invest in, right?
Yeah. So talking about competitive advantage, when you guys started, the idea of bringing IT and biology together was kind of unique. The cat's out of the bag now.
Yeah.
So how do you retain your differentiation going forward? There are lots, even with going public, there are lots of people with even more money to put into it.
Yeah, I think, at Ginkgo, we have people from a lot of diverse backgrounds and expertises, right? We have software engineers, we have data scientists, data engineers, we have AI, machine learning folks, we have computational biologists, we have chemists, biologists, automation engineers, mechanical engineers, you name it, we have it. And, and candidly, lots of people talk about interdisciplinary work and whatnot, but the reality is that these different folks, they speak different languages, right? They use different words. And so figuring out how to bring them all together under one roof and get them to talk to each other, get them to speak the same language, I think can be a huge asset for any organization. And in particular, biotech doesn't always do software and data well. And so figuring out how to bring the best of both worlds is really hard, but also really powerful.
And then COVID hit.
Yeah.
And you guys pivoted in a way that is really interesting given your mission. So tell us a bit about that.
Yeah, so when the pandemic hit Boston in March of 2020, it was a pretty jarring event, right, for all of us and for the world, right? But we also knew it was going to be potentially like a transformational event for the world, right? Because biology went from being this thing that most people ignored in their everyday lives to suddenly being on the 6 o'clock news, right? All of a sudden, everyone's talking about testing and PCR and viral capsid structures were, on your local news. And so everybody was suddenly talking about biology, right? And so we knew that that this was both a worldwide crisis, but also in a weird way an opportunity, right? For biology and biotechnology to be a force of good, right? In this moment of crisis. And so our mission continues to be to make biology easier to engineer. We're still fundamentally a cell engineering company, but we did feel like we had almost like a moral obligation to do what we could to help out with COVID-19 response, right? And so even though we didn't have a background in infectious disease, we did have a very powerful platform for engineering cells. We knew a lot about applying automation to biology, and so we set out to figure out what we could do in COVID-19 response. And so we basically ran a lot of experiments, right? So we earmarked about $25 million to different things. Looked at testing, looked at therapeutics production, looked at vaccine development and vaccine production. And probably the two areas that have kind of panned out the most is we realized that, we have a lot of parents at Ginkgo. I have two kids. And, if you're a parent of young children during the pandemic, it was a hard time, right? I don't know about you, but my kids thrive in school, right? And I wanted my kids going back to school. And so we essentially pioneered what we call classroom pool testing, where, instead of testing each person individually, which is what a lot of what we did in the early days of the pandemic, right? We realized that was never going to scale if you wanted to be able to actually test kids in school, that there's just too many kids in this country. And so we realized that you could do what we call classroom pool testing, where you could instead test all the kids in a single classroom at once, right? Because the reality is, even with Delta variant, there aren't that many cases in schools, thankfully. But when there is a case, you want to find it, and you want to find it quick. And so by testing every kid in a school, by testing one test per classroom, This is another mitigation procedure you can use to keep kids safe and keep kids in school and COVID out, right? And so we actually pioneered this at my daughter's school. I'm very grateful to the principal for letting us do this. And ultimately, other folks were doing the same. Broad was doing this as well in schools in Somerville. And it worked, right? And so we ended up, Charlie Baker, the governor of Massachusetts, adopted it statewide. And now pooled testing is being used around the country. So we're testing in California, et cetera. And so it's really great to have kids back in school to be part of that.
That's fantastic. Thank you. This has been such a fascinating conversation. We could go on all day, and I think just looking around at this room, everyone is wrapped. I'm going to ask one final question for a quick answer. It's an easy question. What's the holy grail of engineering biology, and how close are we?
Holy grail might be terraforming Mars. So we're a little ways away from that, though.
All right. So when we get there, we'll hear it first from Dr. Reshma Shetty. Please say thank you.